hospitals. And to quote Dr. Herson, he has 3 wonderful children and the most patient wife anyone could imagine. Won't you welcome Dr. Herson?
I didn't realize you were going to read that. I'm glad I didn't mention the pets and the chickens in the backyard. Well, I'm Patrick Herson, and I'm a family physician, as Mary Jo said. And I will try to bring a physician's perspective to our conversation tonight. I've also worked with insurance companies, so I've got a bit of perspective there. And I currently work with what I think is the finest organization in that many-year career that I've worked with. As many of you know, Fairview was founded by Lutheran Scandinavian immigrants, and truth be told, I can't remember if they were Norwegian or Swedish, and fearing creating a civil war of some kind, I just always say Scandinavian. And I'm a Roman Catholic active in a southwest Minneapolis parish, so that's why the whole Lutheran, Swedish, Norwegian thing's a little foreign. But you know, it was formed in 1906 with several Lutheran community members coming together with a stated vision of improving the health of the communities that they serve. And just a couple weeks ago, I was at a meeting with Mark Eustace, our CEO, where he said that he thinks perhaps the first time in the 100-plus year of Fairview, we're on the cusp of really achieving that vision. And so it's a very exciting time to be in an organization that sees itself that broadly. It's an organization that publicly speaks about our collective vocation. That comes up often in our senior executive team meetings. Our vocation, our calling to meet that mission. I've never been in an organization that started or ended large staff meetings with prayer and such. And it's very inspiring at many different levels to realize it's the people that are most vulnerable that we are serving in our work. I know from hanging out in many doctors' lounges in different parts of the country that I'm probably a bit more liberal politically than most physicians, and so I don't feel like I'm the Lorax who is speaking for all of the trees necessarily, but I want you to understand my biases and where I come from. I'll also tell you that I've got a child with some chronic health conditions, and so that affects me. I have a 19-year-old who is currently sailing in the middle of the Pacific in a gap year period, whatever this will be, who is currently without health insurance, and about a month ago, just shy of her birthday, I reminded her not to get hurt or get sick until she got somewhere with state health care like New Zealand, because we could get her home, but it'd be awful pricey to do it. So I bring those perspectives to our conversation and our work tonight. I have not read the entire bill. I know many pieces of it. I will say one thing that struck me as I made my transition from Blue Cross to Fairview, from that side of the industry, the financing side, to the delivery side, is that one of the things that struck me in my last year or so at Blue Cross was whenever we'd have health reform on the agenda at senior executive team meetings, it felt like I was talking to my kids when they were little toddlers. It was all no, 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 no. And once I got the bravery to ask, so what do we stand for in this conversation? And there was what my son would now call an awkward silence. And that led me to want to go to an organization and to a part of this conversation where people aren't afraid to be having conversations and talk about this. So it's not to bash Blue Cross or insurance companies, but it's to set the context that many of my answers will come from. So thank you all for coming out. I know your time is really valuable. This will be a lot more fun when we start interacting with one another. And so thank you very much.